couple other people are still kind of logging in. But again, welcome today for Effective Recruitment Strategies for Snapbnt Programs Training. If you've just joined, I've said this a couple times, but if you've just joined, feel free to add your name and location in the chat. And yeah, thank you for being here today. So today's training was designed for state Snapbnt and FNS staff, and it's hosted by Mathematica and Social Policy Research Associates. So just a little bit of housekeeping today. As we're doing the training, again, we want to try to make it as interactive and engaging as possible. If you want to turn on your cameras at any time, feel free to do so, but particularly when we do some of the breakout sessions, if you want to turn on your cameras as you're doing some of those small group activities, that would be great. It does allow for a little bit more interaction and get to know some of the people you're doing some of the small groups with. If you have questions at all during the presentation, you can add them in the chat. We'll be monitoring the chat for any questions while we're kind of doing that presentation piece, but then we will allow after that, we'll either pull up some questions from the chat to read, or if you want to unmute and ask questions, that is great as well. And I also wanted to point out that we will have subtitles available today, so there is captioning. So if you are interested in doing that, you can access these by clicking on the More button or the three little dots, and you can select View Subtitles. And these are auto-generated subtitles. Okay. And again, any questions at all, feel free to add them in the chat at any time. I want to introduce you to our presenter today. We have Gretchen from Mathematica, and I will turn it over to her to do a quick introduction.
Hi, thanks, Alice. So I'm Gretchen Rao, and I'm the Director of Nutrition Research at Mathematica. And for probably the last 20-ish years, I've been studying SNAP policies. And over the last 8 years, nearly all of my work has primarily focused on SNAP-ENT programs and work requirement policies. So for instance, I've led a nationally representative survey of work registrants, ENT participants, and ENT providers to better understand the characteristics and who they are. I also led the implementation analysis of the 10 SNAP ENT pilots, which we'll talk a little bit more about today. And then most recently, I've been providing technical assistance to states and providers who are trying to improve recruitment into their SNAP ENT programs or find ways to keep participants engaged once they start. So I'm really excited to share some of what we've learned through this work.
Great, thanks, Gretchen. So before we get into Gretchen's presentation, we just want to go over some of the training objectives today, just so you kind of know what we have in store for you throughout the next hour and a half. We'll talk a little bit about challenges and lessons learned in recruitment, share some on-the-ground examples, and then we will do a brainstorming session and report out. But before we get into the presentation, we are going to start by doing an activity in Menti. So I'm not sure if anybody has been able to use Menti before, but it's a fun way to do some polling that is kind of live timing, I guess, so you can see results as they come up. And so we're going to get that set up for you, right? Just a second here. Sorry, it's not pulling up for me. So if you go to menti.com and you can type in the code that's listed right there, or you can select on the link that is in the chat right there. And here is the screen. And I'm going to turn it over to Caleb to walk through this activity.
Thanks, Dallas. And I see that some folks are already starting to vote, which is great. But we have a series of questions that we're going to ask everybody, and this is really going to help you kind of get the juices flowing on our subject area and thinking broadly about SNAP ENT services and programs that are happening in your state. So this first question is a nice little multiple choice, multiple selection. It's a checkbox so you can pick all that apply question, and we can see them populate on the screen. This is, what are the primary ways that your state informs SNAP participants about the SNAP ENT program? And I see that we've got roughly about 100 participants on, so I imagine we're going to get a few dots. So I'm going to kind of let this populate a little bit and see what comes up. Right now, it looks like eligibility staff discussing ENT at the certification or recertification phase is most popular. However, people may not yet have read through all the options that are on the screen. And then display or share flyers or posters is another pretty prominent one. And again, just to remind folks, in order to vote, you can, at the very top of the screen, you can go to menti.com and use that access code up there. You type in that access code when it asks you, or you can use the link that is in the chat, and that should take you straight to where you need to go.
Yep, and I would just add as well, if anyone is having any trouble accessing the link, but you want to participate, you can add your vote in the chat, and we can have that to read as well.
Thanks, Dallas. All right. And I like seeing this too. You can kind of get like a big mass, a big sense of where folks are voting. There's still a couple of votes coming in, so I want to give people the chance to do that, because we'll then close it down and move to the next question in just a moment. Thanks, Madeline, for dropping the Menti link back in for anybody that just entered the room. Good thinking. Okay, so we'll freeze this here and save it for posterity. Thank you for voting. Kind of gives us a quick little snapshot. And let's go to the next question that we should now enable you to be able to access on the same link. Nothing's changed. It's the same link. It's the same code. So you should just have access to the next question now. And it is, what is your biggest challenge in recruiting participants for Snapbnt? And this, you only get to pick one. It's a radio button. So we'll get a little bit of a different, nice little donut graph, pie graph, what have you, tart graph, perhaps. This is the biggest challenge when it comes to recruiting participants for ENT. And yeah, kind of prominently noted there, having enough staff just to conduct the direct outreach. Sure, that makes a lot of sense. And again, as Dallas said, if you're having any difficulty voting, you certainly can use the chat and put your vote there. Alternatively, if for some reason your screen stopped working, it looks like it's working just fine for folks, but if your screen stopped working, you can also close it and then re-enter, I think. Actually, I'm not sure if that's possible. Dallas says yes. Okay, great. We'll go with that. So good. There seems like there's a nice little balance. Otherwise, I see having technology to reach out electronically, certainly in times in our COVID world, that's basically a necessity these days. I see not sharing the best way to message the program. That can certainly make a lot of sense, and hopefully today is useful. And identifying who to reach out to is challenging. So good. Maybe another minute or so. I see the voting tart is still changing shape subtly, so we'll give it another couple of seconds. Great. All right. Thank you, everybody, for that. I appreciate it. We've got 2 more questions, and these maybe a little bit more thoughtful, so we're going to give it a little bit more time because these are kind of open-ended questions, but we'll get to see the responses populate on the screen. Again, these are all anonymous, just like the last ones were. But the question is, what is one innovative strategy Snapbnt providers in your state employ to identify and reach individuals who would benefit from Snapbnt services? And there's no wrong answers here. This is really just to kind of get a very quick snapshot on current strategies that are being practiced around the country, and we can all see what people are coming up with. Duplicates are great too. That's perfectly fine. Just anything that comes to your mind, we're interested in getting a big wall of options. different strategies and such. Mobile outreach vans, excellent, nice. And I see social media, sending out notices to participants, reverse referrals. Good, these are really starting to come in now. Collaborating with partner agencies. Postcards and mailings. Good, these are starting to scroll a little bit. That's great. Keep on coming. And the question asks one, I don't know if you get stopped. Oh, somebody had an expletive in there. Thank you for keeping it expletive. This is good. Speaking to them in person, calling, texting, and then email. It sounds like that's quite a process. Another reverse referrals, a few reverse referrals from local colleges. Good, and that, as you all vote or contribute, you can also see some of these that are coming in on the screen. Snapbnt steering committees. Boy, I hope to talk to that person later in the group sessions. High quality local partnerships, work fairs, flyers, collaboration with partners. Good, I'm definitely seeing some training staff. Yeah, I'm definitely seeing there's some commonalities, and then there's some outliers where it looks like there's just one or two similar type things that are happening, but lots of different options. This is great. Thank you. We have one more question that's also an open-ended question. Why don't we bounce to that last one, and then you'll get to put Menti down for a minute. This one is, name one partner, and this might be a little easier. Name one partner that Snapbnt providers in your state could connect with to recruit participants. And when we say could, we mean they're actively partnering right now, so they're available to connect with. And I see MDHHS, Health and Human Services, I would imagine. If it's an acronym that's state focused, it might be helpful for folks. We could probably figure it out. We're all in the space here, but it might be helpful to spell it out if you're able to. Goodwill, community colleges, food banks. Great, and this will start cycling down in a moment, so we'll get to see some of the other ideas that are coming in. I see one column cycling. Oh, there we go. Pennsylvania Department of Labor and Industry, good. Good, again, seeing certainly some consistencies or some similarities across states, and then a couple of outliers. This is great. Wonderful. And I can't quite tell if more and more ideas are coming in or not. I don't know if it's possible to scroll to the bottom real quick. Path in Michigan. Mm-hmm. County welfare departments, excellent. All right, thank you all so much. We'll also make this information, recruitment is the easy part. It's the getting, what does that one say? If you could scroll that one down, Dallas, I'm not sure if that's, you have that power or on the right side?
No, it scrolls on its own.
Oh, okay.
Sorry.
Okay.
This one scrolls on its own. They do
we'll also, thank you, Dallas. We'll also share out these results for folks as well, so you can kind of look back and see the outcomes of what all of your colleagues across the country were inputting into these questions too. So thanks everybody for contributing, and I'm gonna kick it back to Dallas.
Thanks, Caleb. We're gonna turn it over to Gretchen to start some of the presentation portion.
Thanks, Dallas. Thanks, Caleb. So today, well, first of all, welcome and thank you for coming today. I'm going to be sharing some of the recruitment and marketing challenges and the lessons learned from the 10 pilots, 10 Snapbnt pilots, and providing some on-the-ground examples of effective recruitment approaches that could help you as you're trying to bring more people into your program. And so I think most states can agree, it looks like from what we were just seeing, that attracting new participants to Snapbnt can be difficult. And even for states that are administering mandatory programs, getting people through the door is not always easy. And so states often rely on some of the less direct or less coordinated recruitment approaches. I think we saw some of this, things like referrals from SNAP certification interviews, word of mouth from current or former Snapbnt participants, and also reverse referrals from contracted providers. And all of these can be great recruitment tools, but they may not always lead to the programs running at full capacity. And each of them have some drawbacks. So for example, in most states, the Snapbnt eligibility staff, are talking to clients about the program, but they may not have a lot of familiarity with the actual offerings and the services that can be provided. So they may not be the most effective messengers for the program itself. Also, word of mouth can be great, but the opposite can, so the opposite can be true as well, though. If you get one or two bad experiences, that can negatively affect engagement in the community if there isn't sufficient information out there to counter it. And then finally, with reverse referrals, I know I saw a lot of states are using reverse referrals. There can be some missed opportunities in your ability to reach a larger pool of potential participants when you're using only reverse referrals, for instance. So if providers serve a small or very specific population, these referrals may not be directly reaching the SNAP population or ABODs in particular, who may need those services to maintain their benefits. So in order to fully engage people and to better target services, it's really important for states to more actively reach out to SNAP participants and explain the value of ENT, as well as trying to bring them into the program itself. Next slide. So it can be hard to know where to start and what would be most effective, but here's where we can actually learn from the 10 Snapbnt pilots. They were operating between 2016 and 2019, so I will point out this was pre-COVID, but they did end up enrolling about 45,000 participants in 2 years. And I will point out that most of these pilots were not statewide. They were targeted, and some of them were targeted in very rural areas where there was no Snapbnt before, so they really were starting from scratch. And some of the pilots were also targeting more narrow populations, so not just all work registrants, but some groups that were hard to reach, such as people who were homeless or were facing substance use disorders and those kinds of things. So they were much more difficult populations to enroll. All of the grantees and providers that were part of the pilot, faced challenges in recruiting. It wasn't really easy for most of the pilots, but they were able to learn from those challenges that they faced, and most of them were able to kind of pivot and find outreach and recruitment strategies that really worked for their programs. And that's what I'd like to discuss more today. So the first thing is really identifying your target population. And I noticed in the that some people were pointing out in the poll that identifying who to target is difficult. And so it's really important for the SNAP agency to identify who it is they're targeting. Is it all SNAP participants, work registrants, ABODs, or some, prioritizing another group that they'd really like to focus on for Snapbnt? And then making sure that all of the providers or whoever's doing your recruiting knows who those people are, and really educating them about who those people are, but also where to find them is really important. And part of that is developing contact lists that you can share for conducting outreach. So if providers don't know who that they should be recruiting, then it becomes really challenging for them to actually find the people that you want to be serving in your Snapbnt program. In one of the pilots, the state had previously relied on reverse referrals prior to the pilot. And so they continued to do that approach moving into the pilot, but they were targeting an even more narrow population that was hard to reach. And most of the providers were just not able to find those people. They were just not targeting them. Traditionally, it just wasn't the kind of people that they were reaching normally in the community. And the state then had to develop lists and be able to tell them, these are the people that we want you to reach out to. And then providers were much more successful in being able to reach them. Next slide. So now that you know who you want to reach, then it's how do you actually reach those people? So there's a few things that I want to highlight here. First of all, it's really important to develop a cohesive plan and an approach for reaching out to participants and have an outreach plan in place. Some of the pilots that did not have plans in place kind of fell into two groups, and they each faced different challenges. The first group is what I like to call the "if you build it, they will come" group, right? So they really felt like they were offering very robust services and everybody would want those services. And they really wouldn't have to do a lot to attract people to the program. But what they realized is that didn't work out, right? So that people just weren't coming through. If they didn't know about it, they weren't finding the program, and they just weren't sort of gravitating to it. So those pilots had to pretty quickly sort of shift gears, put more resources into recruiting, and really come up with an approach to make sure that they were reaching out to people and telling them about this great program that they had to offer. Then there was another group that allowed their providers to develop their own approach for reaching out and recruiting the participants. And again, this is really great. Like, providers know the community, they know, their programs, and it's important to empower them to do outreach and to, have some say in what they're doing. But what we found is that especially when there were a lot of providers in a given area, the recruitment was really disjointed and not cohesive and kind of inconsistent. And what would happen is there would be, someone would be contacted like 3 times by different providers, and then there'd be a whole group of people that were never contacted. So there was just no coordination happening with how people were being reached. And so the states had to get involved, and sort of at a higher level, they started identifying which groups of people the different providers would actually reach out to, or some of the pilots were able to develop a system in which they could document, each provider could document who they had reached out to, and other providers were able to see that. So that was an important tool to allow for more consistency. And also there were some issues with consistency of message. So particularly when providers were kind of doing their own outreach, there often wasn't a consistent message or goal for the program that was really communicated at a higher level, and everyone was kind of talking about the program in different ways. And so again, the pilots, the grantees at the pilot level decided, or at the grantees level decided that they really needed to ensure that they were telling everyone what is the goal of this program, what is a consistent message that you should be using. And one way to do that was through developing materials and educating the providers about how they should message the program. In some cases, they would develop materials that had, consistent branding and graphics and messaging, and then providers could slightly tailor those materials with their contact information. But overall, they were generally representing the program as the state wanted it to be discussed and messaged. Next slide. So the second factor to consider is when you are developing materials. So these materials can be really beneficial. A lot of the pilots developed flyers, postcards, letters, posters, just a range of materials for reaching participants. But it's just important to make sure that the materials are very accessible and clear, that they include simple action items and next steps. So if someone is interested, being able to tell them exactly what they need to do and who they need to contact in a very clear way. And also being able to concisely talk about the services that are provided, as well as the value of those services to participants. And if you're not sure what actually would motivate the population that you're working with, then go ahead and talk to them, right? So collect information from them to find out, participants who have been in the program before, what was it about the program that they really liked? Why did they decide to participate? What drove them to do that, motivated them to do that? And what didn't they like as much? And try to use that information in the materials that you're developing and in the approach. For one of the pilots, they actually hired a firm to develop their entire outreach plan and the materials that they used for the pilot. One of those is displayed here, one of the flyers they developed. And they actually conducted focus groups and interviews with participants and staff to better understand the needs of that population. And then they actually tested the messaging to kind of see what worked and what didn't work. And then obviously developed the material for the pilot. Also some things, to always keep in mind the population that you're trying to reach with the materials, keeping things at a 5th to 6th grade reading level, providing them in multiple languages if applicable to the different areas. And then something that's a little more nuanced is just ensuring that the services described are available in all the communities. You may need to actually develop a set of materials that are slightly different depending on where you're going to distribute them. Sometimes we saw that if you were kind of in a rural area where they didn't have bus services and some of the information talked about providing transportation assistance in the form of bus tokens or bus passes, people would think, well, that's not for me, or this isn't really targeted to our area, and they don't really understand what we need here. So it's just important to take into effect how participants might view something if it's not really applicable to them. Next, yeah, thank you. So through the process, I think all of the pilot staff recognized at the outset that a one-size-fits-all approach for outreach, or really just focusing on one type of outreach, was not effective. And everyone kind of moved to, or most of the pilots moved to using more a varied approach, including multiple approaches in their recruitment efforts. Not everyone communicates or absorbs information in the same way. And so, and there's really just no single way to recruit. And so it's really trying to find what works for the different communities and for the staff as well that are actually doing the outreach. I think we saw in the poll that there are a lot of states that are creating lists and kind of working from those lists. Most of the grantees, started with that they developed a list of potential SNAP participants who could be eligible for Snapbnt. They distributed them out to staff either at the provider level or whoever was doing the recruiting. And then they would make telephone calls, they would send letters to those folks. But I'm sure, as a lot of you have found, the lists, even if they're pretty current lists, are usually kind of out of date by the time you start trying to reach out to people. Phone numbers get disconnected, people move, letters bounce back. And so starting from the list is kind of the low-hanging fruit. There's some people you can reach that way, but there are going to be a lot of people that never pick up a phone or never read your letter. And so you really have to incorporate other methods as well for recruitment. The next slide. So the staff, the pilot staff ended up implementing an array of strategies that helped enroll more SNAP participants into the pilot. And so some of these included developing flyers and then kind of papering the community with those flyers. So putting them out and displaying them at different locations where the population that they were interested in would likely visit. So places like food banks, community centers, churches, other public assistance agencies like HUD or the housing authorities or childcare organizations. There's an example flyer here that Mississippi developed for their program. You can see on the screen. Also, the two of the pilots primarily focused on meeting people in the community where they were. So they would heavily, they focused heavily on actually conducting home visits. So they would go knock on doors. So in addition to phone calls and letters, they would go to people's addresses and try to reach out that way. They would meet people at locations in the community, like libraries, the SNAP office, community centers, to try to do outreach. One of the programs actually viewed their program as a quote unquote mobile program. Everyone had laptops, Wi-Fi, cell phones. The staff were rarely in the office, and they were always out in the community working with potential participants to recruit, and then also they were doing their case management out in the community as well. There were also staff that were stationed at kind of local events. So things like local resource fairs, back to school events, community events, even just like a parade or a carnival that was in town. They would set up a table or they would distribute flyers, and they had some success there. One of the pilots also heavily leveraged other public assistance programs. They found a lot of success in the fall when people would come in to get energy assistance through the LIHEAP program. The lines sometimes would be literally like out the door and into the parking lot. And they would take that opportunity to kind of have a captive audience and just talk to people if they were interested in the Snapbnt program, because they were likely eligible for it. And they had a lot of success actually recruiting people through events like that. And then also one of the other things that two of the pilots had developed were videos that introduced their programs, but also highlighted participants' experiences and their success stories. And we're actually going to show you one of these videos now. And I just want to point out that this is from Kentucky, and they were targeting several rural areas in the eastern part of the state.
Well, I moved here, back here, after being gone for 32 years. So when I moved back here, I realized why I left 30-some years ago. There wasn't much here to do. I had to sign up on KTAP and food stamps when I first moved here, because I moved here with nothing, no job, no nothing.
Before Path to Promise, I was staying with family in and out of the homeless shelter. I dropped out in 7th grade to help my sister with her kids. And when they was explaining everything about the program and what it does and how it helps you, then I really became interested then.
And I was in a time of transition, and finances weren't what they used to be. So I was here taking advantage of the LIHEAP program for the electric bill that year. A couple people approached me about Path to Promise.
I thought that was just awesome. I mean, here I am coming back here after being gone for so many years and getting to go to college and getting to have a job while I go to college to help me pay for that and to survive. They don't offer this anywhere else.
We didn't feel like we were going to be here much longer because we didn't feel like there was anything here. This really turned things around. They offered help in paying for tuition, books, gas. They provided money for travel expenses. The way everything unfolded has been really awesome.
So you have no excuses not to do the program unless you just don't want to get off your butt and do it. It's a complete support system. Path to Promise helps you get, like last year, our CNA classes, they helped me get my scrubs, my shoes, my watch, everything I needed for that semester. Path to Promise will help you get.
Now I have seen more opportunities. I'm surprised. I'm tickled to death with where I'm at right now.
I don't know where I'd be today without being a part of this. It's worked out awesome.
I never thought in my 30s that I would be going to college, actually making something of myself and being successful about it.
And I'm so grateful for P2P and to give me the opportunity to be able to go to college and still maintain my life with my children.
Thanks, Dallas. So that was just one example of of a video. We're including the link in the chat, and there are some additional videos that we're also including in the chat. They're, again, available, still available on YouTube. They are really just kind of informative. Obviously, these pilots ended and the programs don't exist in the same format anymore. But this just kind of gives you a sense of what some of those videos look like. So one other key point that I wanted to mention was that most of the grantees and providers agreed that coordinating with the local SNAP offices should be a priority for their recruitment efforts. Well, most of them didn't rely heavily on the SNAP staff, the SNAP eligibility staff themselves to do recruitment. They did feel like they should be a part of the overall strategy. Some of the pilots didn't actually talk with the local offices or inform them of the pilots or really like integrate them into the plan. They were kind of worried about the burden on eligibility staff, and they had other staff externally who were focused mostly on recruitment. However, the problem was that they felt like this was really a missed opportunity, because obviously eligibility staff are working with the people that they're trying to reach, and not coordinating with them was kind of problematic. So the pilots that did work with the local offices had a few, suggested a few things. First of all, providing eligibility staff with information and materials that they could actually share with the SNAP participants if they're interested in Snapbnt. Sometimes there were actually postcards that had the contact information for the ENT program on them that they would hand out. Also providing the SNAP eligibility staff themselves with a contact person at the Snapbnt program so that they could make direct referrals, or if they had questions about the program that they just really didn't know the answer to, that they kept getting from participants, they could ask those questions and have a resource. Also, some of the pilots were really successful in stationing staff at the ENT, or at the SNAP office. So they would station Snapbnt staff at the SNAP office. They would either kind of have a table in the lobby, or some of them actually had their own offices there. And they found that to be really successful for recruiting. But the key to this was consistency, that they needed to have a consistent schedule. It didn't mean that Snapbnt staff had to be there every day if they needed to sort of travel around to cover a larger area, but they needed to be there, you know, every afternoon or every Monday, Wednesday, Friday. If it became sporadic, that's when eligibility staff just stopped making referrals and, you know, telling people to kind of walk down the hall, because there was not necessarily going to be someone there. So just ensuring that there is some schedule in place is key to working with the local offices. And then the last point, next slide. The last point that I just want to talk about is about you know, who is the messenger for the Snapbnt program. So grantees and providers recognized that the decisions about who conducted the outreach efforts actually mattered, and it mattered a lot, actually. So several of the grantees kind of discussed the importance of ensuring that the staff assigned to this role had the necessary interest and skill set to perform it effectively. You know, there are a lot of different groups that can do outreach and do outreach, but each has their own challenges. So for instance, using eligibility staff, or primarily using eligibility staff for recruitment, well, they generally understand the Snapbnt program and can talk about it at some level. They generally are not able to answer detailed questions about the providers or the services, and may not really be kind of selling the program and kind of getting people excited about it. Also, case managers are great, or they can be great at recruiting, but not always, right? So they may be fantastic at working one-on-one with clients and identifying the kinds of challenges they have and coaching them to you know, move beyond those challenges, but they may not be the kind of people that feel comfortable or want to cold call people or walk up to them in a SNAP lobby and, you know, and try to sell the program. And this happened frequently in the pilot, that a lot of the case managers did not feel like they knew what they were getting into with recruitment. And sometimes it caused turnover, actually. They just didn't feel like they wanted to do the recruitment part of that job. And then also one point I would make about providers is that a lot of your providers are probably serving clients with a lot of different, or through a lot of different programs. It's not just Snapbnt. And so when providers go out and do recruitment, they may, they're going to be talking about what that provider can offer, and, getting people excited about those services, but they may not be talking more broadly about what somebody could get through ENT if it's not specifically offered through that given provider. And so they may just not have the capacity to focus solely on the Snapbnt program recruitment. So some of the pilots, realized that, some of these challenges, and what they ended up doing was moving to an approach of using a dedicated recruiter. And that ended up being a pretty efficient and effective way of getting people into the program. So, and this happened in a few different ways. So in one pilot, there were Snap agency staff. They were actually doing case management. They ended up splitting out those two roles. So case managers just did case management and recruiters just did recruitment. And they identified staff kind of based on their strengths and their interests, and split them up in that way. In another pilot, they used an intermediary, an organization that wasn't providing any direct services, and they would do additional recruitment for all the providers in the area. And then in another pilot, it was provider based, but those providers, they hired somebody to conduct outreach and recruitment for the Snapbnt program. So there are a lot of different sort of approaches to this, but the underlying piece is trying to identify the people that are the right fit for recruitment. Okay, next slide. So the information, and I know I kind of went through this pretty quickly, but the information that I summarized is presented in this recruitment brief that is linked here. And I think we're going to put this in the chat as well. And then if you're interested in more information about the Snapbnt pilots, we wrote several reports, and there are actually additional briefs that are also presented. There is a set of interim reports and briefs, and then there's also a set of final reports and briefs. And those are also linked on the slide and are in the chat already. So thank you. And I'm not sure, do we have any questions or time for questions?
We had 2 questions come up in the chat, and if anyone else has questions, feel free to add them to the chat. If we don't get to it right now, we should have a couple minutes at the end as well to touch base on any questions. We have one that says, if we were to share SNAP recipient information with community partners, how do we ensure confidentiality?
Good question. So every state, I will say, kind of faces a different challenge with that. In some states, they actually had to get, special permission in order to share that kind of information. And then there are confidentiality agreements that, would need to be signed between the state and any providers or, organizations that are doing that kind of recruitment.
Okay, thanks, Gretchen. One more in the chat, and it's, where specifically have these videos been disseminated for the success videos?
So during the pilot, they were playing usually on video screens at providers, at the SNAP office, at different locations in the community, and then they were available on YouTube. I believe at least one of the sites included links in materials that they distributed. So like if somebody, got a postcard, they could also go to YouTube and see some of those success videos.
Okay, great. And again, if you have any other questions that you think of before the end, feel free to add them to the chat, and we'll make sure that we're kind of monitoring that for any questions. And I'm going to turn it over to Caleb.
Thanks, Dallas. And thanks so much, Gretchen, for the comprehensive and very clear presentation of information. That was, I was actually just sort of riveted actually in everything you were going through. So that was super helpful. And what I get to do is help us think about how we might kind of apply some of these strategies that Gretchen has gone over. Now, for folks who were at last month's session that we had, you might recall that after hearing about promising practices or best practices in terms of strategies for types of service implementation or service delivery, we did a brainstorming exercise where we just collected up a lot of types of questions that would help organizations or entities get the ball rolling on bringing in new strategies or new ideas that maybe they were just seeing during the presentation. What we're going to do today, though, is actually, instead of asking questions, get to start to think about some solutions or some workarounds a bit. So it's going to be a little bit more of how might we apply some of these outreach and marketing approaches that we just heard about from Gretchen and that are available in the linked reports and briefs that are in the chat right now. So why don't we move forward? And what I've done, what our team has done, is we broke down the strategies, or perhaps I should say synthesized all the strategies and information that Gretchen just shared into 4 overarching or broad strategies for outreach and marketing of Snapbnt programs. And that is, number 1, developing a cohesive recruitment plan. 2nd, developing accessible and clear materials for recruitment. 3rd, tailoring the marketing and outreach strategy. And then lastly, selecting your messengers, who's actually going to carry that message itself. So everything that we just heard about from Gretchen really came out of these 4 broad strategies. And in a moment, what we're going to do is you're going to get split. You don't get to choose this time. We're just going to push you, but you're going to get split into one of 6 breakout groups. And with your fellow participants in that room and with a facilitator, one of the folks from our team, you'll have an opportunity to think through one or maybe a second, maybe 2 of these strategies a little bit more in depth. And so what that's going to look like is as the following. And let's go to the next slide. So we have broken down or set up, we're going to use a tool that we used previously in the last session called the Jamboard. We're going to send everybody there again, and we'll drop a link in a moment to the Jamboard. I'll also show you how it interacts, but it's going to take you to a Jamboard that looks like so, with 4 boxes. And as a group, what you're going to do is you're going to select a primary strategy or a first strategy that you're going to focus on, and then answer or fill out these other 3 boxes. So your goal for the 20 or so minutes that you'll be in a breakout group is to essentially fill up this box using sticky notes again, just as we did in previous uses of Jamboards. And I will share my screen and show how the Jamboard actually works. So yeah, thank you so much, Dallas, for turning that over. Let me share this. So here's an example of, here's a generic Gretchen group, group 2. All of the facilitators have been assigned to groups, but nobody else has been assigned. Everyone's just going to get randomly pushed. But what you're going to do in your group when you first get there is, through conversation, or your facilitator will help you figure out how, as a group, you will select 2 of these strategies, one to focus on, and then a second one to focus on if you have the time to do so. And it's going to be the developing a cohesive recruitment plan, developing accessible and clear materials, tailoring your market outreach strategy, or choosing your messengers. And so your job is going to be to click and drag what your first strategy is. You can choose a second strategy, again, by picking one of these 4 sticky notes, just clicking and dragging it once you've made your selection. And then once that happens, you'll be asking these questions. I'm going to move these out of the way momentarily. You're going to be asking these questions. What are you currently doing to advance this particular strategy, this first strategy, and then the second strategy in your state? And you're going to be in groups with people who are not necessarily from your state. So this is an opportunity for you to chime in as a representative of your state or as a representative of your area who knows what you're doing in those strategies to create a sticky note and drop that in here, what you're doing to advance. So let me show you how to create a sticky note just as a refresher. Everybody will have access on the left-hand side to this little control panel. The square, this little white or clear square here is the sticky note. You'll click it, you can type words into it, hit enter or hit the save button. And then once you click out of it, the sticky note appears and you can move it, you can resize it if it's easier to fit in with others. That's however you want to manipulate it is perfectly fine. You can double tap to go back in and type more and it'll be there. Okay, so you'll do that for this box, a couple of minutes. The third box, what training or TA resources might the state offer to encourage providers to work on that strategy or advance that strategy further? And then what other ideas for supporting recruitment broadly come to mind that could be explored further? Okay, so that's also a little bit of a brainstorming section, but your objective is to fill out this grid and to at least do it for one strategy. And if you have the time, do it for a second strategy. There's one caveat that I want to make just aware for everybody, because we're all going to be interacting with Jamboards, and that is Jamboards is a relatively intuitive tool to use, but it's also a simple tool to use, and everybody is going to be an editor in the system so that you can create these sticky notes. However, in creating this visual, what we've done is we have essentially created a series of boxes to represent the 4 boxes. And it means, since everybody's an editor, you potentially have the power to move those boxes out of place accidentally and drag them like so. You also potentially might drag the text out of the box. I don't think that'll happen. It won't happen as long as you're using sticky notes. But should it happen, I just want folks to be aware of that. And you have, if you're the person that actually did the dragging, you have the power to move it back to right where it was by holding the control button and clicking Z. The good old Control Z power allows you to back up, and it puts things right back to where they were previously. Okay, so I just want to flag that for folks that might happen. I hope it doesn't happen, but in doing your dragging around of sticky notes, if you accidentally grab the text box or the outline boxes, that you may need to Control Z and then try and grab your sticky note again, okay? And your facilitator can again help you keep that all organized and clear. It's not the end of the world if a box is dragged out of the way, okay? All right, I will stop sharing. Oh yes, Kristen dropped in the chat. There's also the undo button in Jamboard. So if Control Z doesn't work for you, you can also click the undo button. But again, nobody else can do that for you if you're the one that dragged it. Okay. So with that, we're gonna have no more than about 20 minutes or so to work on this together. You're all gonna get a facilitator. When we come back, we're gonna ask to hear again, kind of like a quick 30-second snippet from what each group had to say. So I hope there's somebody that will be brave enough from each group to share what their group spoke about. And with that, I think I can turn it over to Dallas to help push us into breakout groups.
Okay, so I am opening up the breakout rooms.
Okay, welcome back, everybody. I think we have everybody back in the room, or at least very close to back in the room, hopefully. If they're not back in, I imagine they'll be back in shortly. And I also, for the first time I've ever experienced, we did it. We overloaded Google. I don't know how that's possible, but Jamboard is a Google product, and somehow we managed to overwhelm them. I had a couple of people in my group at first who couldn't get in and had to try a couple of times in order to interact with the system. So we're going to look into that and see, because we don't want that to happen next time as well. But thanks for folks sticking with it. If you had to make an audible by voicing your ideas or putting them in chat or whatnot, and hopefully they got dropped in. We are starting to bump up on time, but I want to give space just about 30 seconds or so for each group to share with us some of what they heard or some of what they discussed about. And so I'm going to go through the groups real quick. Dallas, I'm going to ask if I can share my my screen again.
Yep. Let me, there you go.
Thank you so much. Let me go to my Jamboard, but I'm actually going to back us up to the first group and ask, is there a representative from Madeline's group who could give us just like a 30-second overview of some of what you discussed?
Well, I can say that mostly Kimberly and I from Washington State had a great discussion, and others, some had trouble with their microphones, but people shared on sticky notes. And I don't know, Kimberly, I think we got the most excited thinking about how to use career technical education folks as messengers so that youth are coming out of high school and getting connected immediately into SNAP employment training plans. I don't know if you want to add anything, Kimberly.
No, you're doing just fine. Thank you.
Great. Thank you, Madeline. Thank you, Kimberly. All right, let's move forward. I'll just keep an eye on the time to Gretchen's group. Looks like there's also some good ideas here. And someone chose choose your messengers. Excellent. I was hoping that one. I was afraid that one would get left off. So Gretchen, is there somebody from your group that is willing to share for about 30 seconds?
Ariana or Sarah, would you like to kind of summarize what we talked about? Or not? I can just quickly, sorry, I can quickly just say, like, there was a lot of working with eligibility staff as sort of the messenger for the programs. One of the places that we talked a little bit about of expanding was around community partners, of trying to better kind of leverage other organizations in the community and kind of one stop of where they could talk about the Snapbnt program as part of when people come in for a host of other things into those organizations. And there was a lot of need for training. That was really the piece of, training eligibility staff, best practices, training providers around this recruitment piece and trying to make sure they can identify the right people. So.
Splendid. Thank you so much, Gretchen.
Mm-hmm.
Okay, let's jump forward to, this is Anne's group. Oh my goodness, quite a number of comments here. Who could make this a concise speak out for about 30 seconds or so?
I think Alicia may.
Yeah, I will try my best to do so. So we discussed developing accessible and clear materials. And so what we noted was that it's really important to connect directly with the provider and get their feedback and help to develop the information in order to know what kind of language to use on there and kind of coordinate that with the state agency. So it's really kind of dealing more with the ones on the ground and working directly with individuals to really gear those materials. And so by working directly with the providers, we're able to get more accurate information and success stories. And we're looking to work with communicating and tailoring marketing materials to keep it kind of a clean and easy to understand and language that customers can relate to, and hopefully that would be received better.
Great. Thank you so much. And let's go forward to my group. Yay, and let me move this off because we focused primarily on developing a cohesive recruitment plan. And who would like to give us a quick little 30-second synopsis from our conversation?
I can jump in. We talked quite a bit about how to make sure that the information that's being presented is really concise and accurate. Talking about, using flyers or using steering committees. Talked a lot about how Many of our states have providers that really are doing their own recruitment just because of the way it's set up, or a lack of state staff to come alongside and support them. We talked a little bit about gathering feedback from existing participants to make sure that we're making appropriate adjustments to the recruitment strategy to make sure it fits for the communities that we're trying to reach out to. Talked a little bit about utilizing outside TA like Snap to Skills with SJI, including a recruitment process and maybe a provider handbook, and really just kind of seeking clarity again on how to make this consistent across the state when working with a number of different providers in different areas.
Thank you so much, Sarah. That was excellent. And also we hit the golden ticket of what you want out of TA, which was people sharing information so they could connect about ideas later, which was also beautiful to see. Let me move quickly. We're getting close to Kristen. Kristen, you all had Choose Your Messengers too. Great.
Yes, we did. And I see that we're running out of time. Yeah, so we had a lot of conversation. Tammy talked about using the infrastructure, the existing infrastructure geographically and program-wise across West Virginia. Tom and John had a lot to share on partnerships. John, particularly college partnerships and the role of navigators. And then Karina, I just want to ask you to build on some of the comments that Gretchen's group and Madeline's group noted. I think some of the content was similar. I wanted to know if you want to come on for a sec. That's all right. But yeah, so there's a little bit of confusion about why the some of the pilots demonstrated the effectiveness of using a wide variety of messengers, but there's a little bit of confusion about what might feel like a push toward eligibility staff playing that role. So a little bit of confusion there, and some guidance would help on that front, maybe.
Thanks so much, Kristen. And then Vince, you've got the very last group here. So let me turn it to you.
All right, I'll be
30
super
seconds.
brief. Great team. We had Iowa, Michigan, and Washington in the House. One of the challenges that was identified is that this is all arm's length removed, right? This is about how you get a procurement done that then recruits or selects the right provider that is then essentially doing the outreach. So writing that into the RFP is a challenge. There were some good examples about radio commercials, and driving people to a web form to then request information with kind of mixed results, but still it's a new channel, a new attempt, and other good examples that are on the board. So I'm going to leave it there. Great participation. Thanks, Gina and Addie and Bessie.
Wonderful.
And back to you, Caleb.
Thanks so much, everybody. We will keep the Jamboards saved so folks can go back and look at them later. So feel free to review as you're thinking back on what you're doing. And with that, I'll turn it back to Dallas to, I think, just take us out.
Thanks, Caleb, and thank you, everybody. We're right on time, so I want to respect everybody's time and end the training. Just want to thank everyone for their engagement today. Sorry for a little bit of technical issues with the breakout rooms, but it looked like it worked out just great for everybody. And then just want to remind people, as you close out, you will get a pop-up for a survey. So please fill that out so we can use your feedback in planning the next training, which will be September 14th. And we hope to see you all at that training as well. Thank you.